Hello everyone, my name is Lily Kidd and today I will be talking about the bacteria Bartonella henselae, the bacterium responsible for cat scratch disease. This presentation will walk through the patient case, clinical findings, and the diagnostic process. So today our patient is 35-year-old male from southeastern Kentucky who recently adopted a stray cat, and this little detail becomes very important later when determining the cause of all his symptoms. The patient presented to the ER with flu-like symptoms, a low-grade fever, and sudden blindness in both eyes. He had previously visited the urgent care and was given antibiotics, but his symptoms continued to worsen. On examination, he had large swollen lymph nodes and multiple scratches with blisterings on his arm. He had no significant past medical history as well. Initial lab tests were negative for mono and the flu. They tested for mono because of his very large swollen lymph nodes, and the flu because it was actually flu season. Our BACTEC blood culture system alarmed positive for an organism just a few days later. And on the gram stain, it showed gram-negative bacilli, but they were difficult to visualize. So we used a Warthin Starry silver stain, and it very much helped in the identification of the small gram-negative bacilli. So what was the organism identified? We identified it through an immunofluorescence assay to help confirm the identification of Bartonella henselae. When combined with the patient's recent adoption of a stray cat and the visible scratches, this provided a very clear clinical picture. Although the patient received antibiotics, cat scratch disease often does not respond well to them. The infection is typically self-limiting and can take 2 to 4 months for full recovery. Much of the illness is caused by the immune system's response rather than high numbers of bacteria. So a little bit more about Bartonella henselae. Its symptoms include low-grade fever, enlarged lymph nodes, papules or blisters at the site of the scratch, and it's very difficult to diagnose, which is all of the symptoms we see with this patient. Bartonella henselae infections are seen throughout the U.S. but are most common in southeastern region. The disease primarily affects children and immunocompromised individuals. Interestingly, cases tend to increase during colder months, probably likely due to time spent indoors with pets, specifically cats. Cat scratch disease is transmitted through scratches from domestic or feral cats, especially kittens. Fleas carry Bartonella and contaminate the cat's claws with the infected flea dirt. Severe cases can cause inflammation of the conjunctiva, retina, or optic nerve of the eye, which explains the patient's sudden vision loss. And I also included a picture of that for you here from the CDC if you would like to look at it. Bartonella henselae is a fastidious gram-negative rod. It does not stain well with a typical gram stain, which is why we use the silver stain. In culture, it grows very slowly, taking up to 3 weeks, making molecular techniques essential for diagnosis. For the identification of Bartonella henselae, or really any Bartonella species, there is all kinds of serologic testing that can be performed. It is actually preferred over regular cultures because of the time it takes to fully detect this organism through blood cultures. Cultures can take up to 4 weeks because it takes the species up to 21 days to grow on blood agar and chocolate. But once grown, it can be subcultured to more specific media and takes about 3 to 5 days to grow and identify. Because of this long time period, PCR testing is the most common use, not only for its turnaround time, but for its specificity. The organism is within the cells, making it easy to detect through specific IgG and IgM antibodies that we test with the blood specimens. So depending on the test, samples may include whole blood, serum, or tissue biopsies. With PCR, it is typically performed on blood or any lymph node material. For the treatment, in most cases resolved without antibiotics, like I mentioned before, but treatment may be recommended in moderate or severe cases. Azithromycin is commonly used and may help lymph nodes shrink more quickly. So antibiotics especially in lymph nodes, there are often few viable bacteria left, so antibiotics have limited impact. However, antibiotics may still be used in certain situations, such as when the lymph node swelling is severe and persistent and complications occur, including ocular involvement, like we talked about, and it may require specialist care. Research shows that symptoms often result from the immune response rather than active bacteria. So, in conclusion, Bartonella henselae can be challenging to identify and grow using traditional methods. However, with modern molecular diagnostics like PCR, labs can detect this organism much more efficiently. Understanding patient history, such as a recent cat exposure, is essential for making the correct diagnosis. And in this presentation, I based it on information from our class lecture notes and 2 articles. One of them was from the Centers for Disease Control and Prevention. It's called About Bartonella henselae. And the second article is called Recommendations for Treatment of Human Infections Caused by Bartonella Species. And I included links for both of those in my cited works. And that concludes my presentation. Thank you.